collection because it is covered by tunica albuginea. So now what is this? This is head of, yes, head of epididymis, and this is testis. So testis is a homogeneous medium level echo. Homogeneous means look same all over. Look same all over. That is called homogeneous. So testis homogeneous medium level hypoechoic smooth texture. Texture is smooth. And epididymis is complex looking or heterogeneous. It's coarse in texture. Coarse in texture. Epididymis. Okay? And you'll see like that, and these are the extra tissue area. If there's a fluid, and you can see the fluid over here. We'll talk when we'll discuss about the pathology. Okay, so this is the sono appearance of the testis and epididymis. Look at here, we see the head, but what is my body and tail? There is no body and tail here. But if it is infected, then you will see the body and tail at here. Okay, so normal sono appearance, then scrotal pathology protocol technique. Good. Protocol technique. Patient's preparation. Patient's position. Transducer selection. Privacy. Swiping or survey. Scan planes. both in sas and transverse. Explain the procedure. Instruction. Start the normal side first. Complete the protocol. You will take the gray images and the Doppler images. Did you scan the scrotum?
Mm-hmm.
Good. So patient's preparation, no prep except loose dress and shaving cleanness. Okay. Position the supine. Supine position, that you have to be careful, that you have to expose the scrotum only. That means penis will be covered by a separate piece of cloth. Transducer selection. High frequency linear sequential transducer. Normally we scan 10 megahertz. Some places they use 12 megahertz. If the scrotum is big, big means enlarged due to hydrocele or hernia, just like a football, so then you have to use low frequency transducer. Even you can use the curvilinear transducer. Privacy must, because it's a organ, sex organ, okay? Privacy is a must. It's a sensitive organs, so that nobody can complain. So what is the procedure? Do not make frequent eye contact. Do not let that patient, sometimes you will say the patient is 19 years old and the sonographer is 21 years old. A sonographer is a female. Most of the times you will see the man will scan the scrotum, but sometimes you are working in the emergency stat order, you have to do it. But make sure your appearance, your attitude will control everything. Your tone of the voice will control everything. Now swiping. Swiping means swiping both in SAS and in transverse. Why swiping before taking the original picture? Why?
To see if there's something wrong.
Yes, it's a quick survey. Quick survey, is there any pathology or not? Then if you see it is normal, there is nothing wrong, you have peace of mind. But if you saw something, then your brain is smart. Your brain will make a story in your subconscious mind how you going to discuss or describe that things and what it could be, right? So you will make your plan that how we going to complete the total protocol. Okay, scan plane, SAS and transverse. Now explain the procedure so that patient cannot complain that, oh, I didn't know that you're going to touch me. Make sure. And instruction. What is the instruction? I'm not going to tell you anything because I am not authorized to tell the diagnosis or anything about the exam. I am not authorized. So then I'm going to send the pictures to the radiologist. Radiologist will make a report for your doctor. Your doctor will talk to you. Then right away the patient says, oh, how long it's going to take? Then according to the system in your department, if it is 24 hours, till 24 hours. If it is 48 hours, till 48 hours. So that they cannot bother you. And start the normal side first. Because the normal side will give you the impression about the normal. Then you're gonna compare the abnormal things. Then complete the protocol. Grayscale images and Doppler images. In Doppler images, what we do? We click the color, right? Then we figure it out artery. We figure it out vein. And just do the Doppler. Spectral wave of the artery and vein is a super plus point for you. Okay? Then you will see. Now I will give you little depth in during the protocol. You have to maintain this practice, this policy, so you will be fine all the time. At the beginning, make sure you need to fix the depth, gain, focus. Don't change the gain. Even though if you do the Doppler, don't change the gain for color Doppler gain for every images. So then you will manipulate the color. You will show, oh look, right testis is more vascular, but actually it is not infected because you increase the color gain. That's why you have to set up your gain. Say 60%, leave it 60%. Complete the whole protocol with 60% color gain. Okay? Same thing for the 2D gain too, or overall gain. So now what you're going to see, there is a median raphe and there is a shadow, you will see. So now you get the two testicles. So now tell me, it is a SAS view or transverse view? transverse view. So this is, you're going to write down trans both testes. We need to take this image first. Why? We need to compare the size, shape, echogenicity, texture, vascularity, any fluid collection, okay? I need to compare. So this image would be grayscale, and second image, click the color. Then you can figure it out. The vascularity on both testicles is almost the same, or one is high, one is low. Okay, so this is very, very important. Then you have to do individual testes, individual protocol pictures. So now understand first, the testis is an oval shaped organ, and testis has this length and has its, so this is length and this is height, and the cross section, this is has, and cross section it will be almost round, a little egg shape. Here you will see retitestis. Okay, you're going to see the retitestis over here. So now this is has view, this is transverse view. In transverse view, you have to measure diagonally here. So this is width, and this is upper pole, and this would be lower pole, right? And this is SAS mid, and this would be SAS lateral, this would be SAS medial. So now our protocol image is SAS mid, with or without measurement. Okay? In this view, click color. Check the color, vascularity. Then take the picture, SAS, if it's the right testicles, SAS right testis medial, SAS right testis lateral. So now, in transverse, take picture, transmit right testis with or without measurement. Then trans upper pole, trans lower pole. If it's the right testis, you're going to write down right testis. Make sure when you do the trans upper pole, that means testis is hanging like this and it has epididymis. If there is pampiniform plexus, so pampiniform plexus is here. It goes along with the upper pole. Just go above the upper pole, you will see the pampiniform plexus. If there is a varicocele, then you will see it is dilated. Okay, so this is pampiniform plexus. So now, when you see the pampiniform plexus, click the color. Then you will see lot of colorful red, blue. Then you feel like, okay, let me measure the thickness inner to inner, only the anechoic area. If it is greater than 2 millimeter, some book says 2.2 millimeter, only the height or diameter, it is considered as varicocele. Then do the Valsalva maneuver. What is Valsalva maneuver? And why did you do that? Because I feel like it could be a pathology. So then I asked patient to do the Valsalva maneuver. And if you see, it was 1.5 millimeter, now it is 2.5 millimeter. The diameter of the vein. What does it mean? During the Valsalva, there is a backflow and the valves are incompetent and the blood vessels are dilated. It indicates that patient has varicocele due to incompetent venous valve. Got it? Mm-hmm. Good. So, if you see, then if you suspect, then you do it. If you see no chance of varicocele, then don't waste time. Okay, so that is a complete, say, right side it is done, same thing on the left side. Same thing on the left side. Now, question. If I see something, can I take more images? Mm-hmm. Of course. Of course, you can take more and more and more images. Okay, so then you're going to cover, you're going to complete the protocol, then scrotal pathology. Let me see. Oh, it's 8 o'clock. Yeah, scrotal, so this is one of the major things that I need to cover. So I will finish this along with the prostate gland next time, okay? Prostate gland, they will ask very clinical questions because people are suffering from prostate gland. They will ask couple of set questions that you can answer those